department, and she's a postgraduate program director. She's a member of our committee and has been a very enthusiastic supporter of helping us learn about lifestyle medicine. And she's actually recently become certified as a lifestyle medicine physician. So I'm going to hand it over to you, Susan, and you can introduce our guest.
Thank you very much, Leslie, for your kind words. And it's my absolute pleasure to welcome Dr. Pojednic and introduce her. So Rachele Pojednic, PhD, EDM, and is an assistant professor and program director of exercise science in the Department of Health and Human Performance at Norwich University, and a research associate at the Institute of Lifestyle Medicine at Harvard Medical School. Her current work examines lifestyle education for healthcare and fitness professionals and nutrition supplementations and physical activity interventions on muscle physiology and performance, as well as muscle-related chronic disease. Dr. Pojednic received her PhD from the Tufts University Friedman School of Nutrition Science and Policy in Biomedical and Molecular Nutrition and Exercise Physiology. She also holds an EDM in Physical Education from Boston University and a BS in Cardiopulmonary and Exercise Science from Northeastern University. Her research at Tufts was completed in the Nutrition, Exercise Physiology, and Sarcopenia Laboratory at the USDA Human Nutrition Research Center on Aging, where she was awarded the Ruth Kirsten National Research Service Award by the National Heart, Lung, and Blood Institute. Dr. Pojednic serves as a co-chair of the American College of Sports Medicine, ACSM, Exercises Medicine Education Committee, was the interim executive director for the Prescription for Activity Task Force, and served on the American Council of Exercise Industry Advisory Panel. Dr. Pojednic and her research have been featured on NPR, Time, Popular Science, Self, Forbes, and Boston Magazine. So I attended Lifestyle Medicine Conference a couple of years ago at Harvard Medical School with her presentation, which was so provoking. And I applied those take-home messages and in my daily routine, and hope that you also enjoy. And I hand it over to Dr. Pojednic.
Well, thank you so much for that very kind introduction. And thank you so much for inviting me to speak to you. This is one of the most important things that I feel like I do in my professional career, is working with practicing physicians and healthcare professionals to really think about how we can use lifestyle strategies and lifestyle behaviors in order to help our patients, but also to help ourselves. And so it's really critical. And you'll see as I go through my presentation today that you are the first person, you know, what do they say when you're on the airplane, put your oxygen mask on first, right? And so I think when we think about self-care strategies, when we think about lifestyle strategies, we're often thinking about how to give these strategies to our patients. But what I would really like for you to take away from this presentation today are some strategies that you can use for yourself. So I'm going to share my screen here so you can see my PowerPoint. Sabula, can I just get a thumbs up that we've got the PowerPoint up that you can see? Amazing. So the title of my talk this afternoon is Resilient Bodies, Exercise, Nutrition, and Sleep for Physicians in a Challenging Time. So the overview of the talk today is just to give a brief introduction to myself. And then what we're going to do is we're going to talk about stress for a few minutes and mindsets. And I'm going to show you some really provoking and thought-provoking studies that have been done quite recently in this idea of stress and how we can use our mind and the way that we think about stress to actually impact our health. And then we're going to take a deeper dive into physical activity and exercise. We'll talk about diet and nutrition, and we'll round it out with sleep and recovery. So Susan gave such a lovely introduction. I don't need to spend much time on this slide, but I just would like to say that it is, one of my major areas of research is looking at behavioral strategies and lifestyle interventions, and working with physicians and other healthcare providers to integrate this into their own practices to change the behaviors, again, of themselves and of the patients that you care for. I'm an athlete, and I've been working with the Institute of Lifestyle Medicine for a significant period of time. And we like to say at the Institute and at Harvard Medical School that we walk the talk. And so I think very strongly and very often about how we can incorporate these behaviors into our own lives so that we can be good role models for our patients, our clients, and those that are in our community. And then one other thing that's really important to me is science communication. And I think that we can sort of look around the last 2 years and realize that we need to be better at telling stories around the practices that we know to work, and that the storytelling and the connecting with our communities and with our patients is critical to getting the knowledge that we have out to the general public. And so I do a significant amount of work with the media outlets and at universities and working at conferences to really figure out how we can use our knowledge and create communication strategies where we are not only breaking down silos in between each of our professions, but collectively coming together to make sure that our patients are getting all of the best information. So I want to start with this idea of resilience. So resilient bodies. Resilience, the general definition kind of varies place to place, is the ability to recover from setbacks, adapt well to change, and keep going in the face of adversity. And I think that this is probably something that we would want to all cultivate in ourselves, in our family members, and in our patients. And there are some really unique and important strategies that we can employ in order to cultivate resilience in our own lives. I think the important thing about resilience is understanding that it does involve this idea of bouncing back from difficult experiences, but it also involves profound personal growth. So learning from these experiences and really thinking about how we can create our own strategies and our own skills so that when we are in contact or come into a situation where we experience stress or setback, again, we have these new tools that we can rely upon. And I think the critical element here of resilience is that it doesn't mean a person won't experience difficulty or distress. And I want to highlight this as we go into a little conversation about mindset. It's really important that stress is a part of our life, and there's really no way to get rid of it. And so we need to think about how we can create strategies to think about that stress, to think about how that stress is affecting us, and then subsequent strategies to manage it. And this is going to include cultivating behaviors, thoughts, and actions that, and I think this is really important, anyone can learn and develop. That being said, increasing resilience takes time and intentionality. So as we come through these strategies, I would love to tell you, because I know that you're all incredibly busy, I would love to tell you that I have the 5-minute strategy to changing resilience for the rest of your life. I unfortunately do not. I am a realist, and my work has also shown that these strategies and these behaviors take time to cultivate. The good thing is that they start to come fairly quickly, and they are self-perpetuating. So as you'll see in just a moment, once you're started down this path, if you're not already, then it really starts to get the ball moving. When we think about the core components of resilience, it depends on what, which researcher you're quoting or what strategy you're looking at. But really, there are some connecting themes that look at connection. So this is human connection. This is connection between you and the environment, your community. It's about wellness globally. It's about healthy thinking. I want to highlight that. It's about healthy thinking, and it's about creating meaning. So without being particularly triggering, because I am sure that you are all well aware of these statistics, physicians are at an all-time high for stress and burnout. The last 2 years have been probably more difficult for you and for your colleagues than any other group on the planet, actually. And I just want to say that this data actually was generated prior to COVID. So when we're looking at some of these statistics, I think it's really important to note that this was a problem before the prior 2 years. And this is something that we've been working with at the Institute of Lifestyle Medicine. And I am now working with at Norwich University to try to help. So when we look at physician stress and burnout, we see that 80% of physicians say that practicing self-care is very important to them personally. However, only 57% practice it often, and only about 1/3 do so only sometimes. And I think that this is something that's so critical to realize, is that when people go into the healthcare industry, the physicians, the nurses, the allied health professionals, people go into it, and I've been training, healthcare professionals, dietitians, physicians for years. They go into it because they're helpers. And oftentimes they're helpful to everybody else in their life and their community before they are helpful to themselves. And so I think what happens more often than not is that these self-care strategies get put on the back burner, get put on the back burner, get put on the back burner until you get to a situation where you're no longer able to even engage in these self-care practices. And the major reason, not shocking to anybody, is that the lack of time and mounting job demands are the two major reasons that people are not engaging in these self-care strategies. And then finally, as things get put onto this back burner continuously, burnout tends to be the last reason why people just can't engage at all anymore. Almost half of physicians say that family demands interfere with ability to practice self-care. And I think over the last 2 years, with figuring out childcare on top of everything else, that's only become more important. And 20%, as I mentioned just a moment ago, feel guilty taking time for themselves. However, this is the take-home bullet point of this slide. Nearly all physicians, 98%, believe that self-care positively impacts their own mental health, and that 97% believe it has a positive effect on their own physical health. Further, about 9 in 10 physicians agree that self-care should be an essential part of overall health. And when we say self-care, although it is lovely to go get a manicure or a massage or get your hair cut after COVID restrictions have been released, what we're really talking here about are lifestyle strategies that are going to enhance resilience and enhance your ability to be a thriving person. I think as we look at, as I've mentioned, these last 2 years, again, this was an article that was written in November of 2020, is that healthcare workers have been saying for over a year, coming on 2 years now, that you are at the end of your rope. And the most precious resource, as Ed Young said in this article, and he was speaking specifically about the US healthcare system has in this current pandemic, isn't a drug, although we do know the vaccines are working. It's the expertise of you, the healthcare workers, and that you are struggling and you are exhausted. And so what I would like to do with this talk is talk a little bit about resilience, talk about mindset, how we can think about health in a time of crisis, hopefully as these restrictions start to loosen over the next several months and year. I think it's important to really look at what stress is before we start diving into the behaviors that are going to help you cope with stress. And I think it's really important to look here at the different types of stress. So if you look at the left of this slide here, you can see that there is a significant range in when stress is occurring and whether or not it is going to be helpful or harmful in our day-to-day lives. And this is critical to point out, is that we see stress in headlines, we see stress in research papers, we see stress in your social media as always a bad thing. And I first want to start to reframe this idea. Yes, of course, stress in excess is going to have detrimental effect. And we're going to call that stress distress. And distress at the very beginning might show up as fatigue. It could potentially feel like exhaustion, and eventually it's going to work itself into ill health. You're going to have physiologic changes in your body due to this stress, and you'll have breakdown and burnout eventually. But what I'd like to call your attention to is this middle section of our bell curve here. And this is a situation called eustress. And eustress, I'm sure that you have seen this before, is a situation where you have enough stress that you feel challenged, that you feel excited, that you feel engaged. And as a result, you feel energized, you focus, your work in some cases feels effortless. So there is a term called flow that Michele Csikszentmihalyi created, where he was talking about engaging in something so enthusiastically, so mindfully that time feels like it's standing still. And the only time that that happens is in this moment of just enough stress. On the other side of the bell curve, we have not enough stress. And in this case, they call it calm, but I think that you could probably also call it boredom. And you've probably experienced this too, especially if you are, kind of a type A, go get them kind of person, is that you get to this situation. And I know I've done this before. You go on vacation and you're just like, what am I going to do with myself? I have so much time. Eventually you settle in and you have a margarita and everything's fine. But there is this moment, if you don't have enough stimulation, this can actually also lead to depression over the long term. And so we want to think about stress, and I'm going to come back to this with exercise and with nutrition and with sleep. We want to think about this as just enough stress, and how can we create a healthy relationship with stress so that we're not feeling like it is pushing us into that distress zone. So what I'd like to think about first as a proposition is reframing the stress mindset. Now, I'd like to call on the work of Dr. Alia Crum. So she is at Stanford University in the Mind and Body Lab. And if you haven't seen her work, I highly recommend checking it out. She has worked with, all kinds of different populations. You'll see some of her studies over the next few slides, working from hotel workers to the average population, all the way out to working with Navy SEALs. So definitely different populations that experience stress in very different ways. And what she has noticed across the board, regardless of the population that she works with, is that the way that we think about our health actually changes our health outcomes. And when I first heard this, I said, as a biochemist, I'm a trained, nutritional biochemist and exercise physiologist. I was sort of thinking like, yeah, of course, the way that you think about things is going to change your attitude about it or the way that you approach things. But if you look at her work, what she is actually showing, and I'm going to give you a little bit of her data over the next few slides, is that the way that we think about our health changes our physiology in very mechanistic related ways. So one thing to think about when we look at stress, as I mentioned, is that most people, if we say the word stress, think about it immediately as negative and almost immediately think about it as debilitating. And what we know is that how a person thinks about stress is going to determine the way that that stress affects their body. So if you go into a situation thinking this is going to be super stressful, it's going to be very overwhelming, that is in fact the way that you are going to experience it. That being said, the beliefs about stress then tend to be self-reinforcing. So every time you have that experience, you're going to basically end up putting yourself on that hamster wheel where something that is feeling stressful becomes stressful, and then it continues in that way. That being said, Dr. Crum has come up with a couple of terminologies that are important. She talks a lot about stress is enhancing mindsets. And these are people that think about, I am going to go into this situation. It's going to be stressful, but as a result of this stress, I am going to come out stronger on the other side. It's going to enhance me in some way, whether it's through health, whether it's through performance, whether it's through well-being. And as a result, they tend to have those experiences. And again, I know what you're thinking. This isn't, some kind of Pollyanna, oh, if you just, downplay the stress, it's going to go away and it's going to feel fine. No, that's not what we're talking about here. What we're talking about with a stress is enhancing mindset is looking into this stressful situation and saying, this is going to be hard. I know it's going to be hard. And what are the tools and the coping strategies that I have that are going to get me through it so that I have an enhanced health, performance, or well-being on the other side? And the interesting thing is that there are people, and this is a spectrum, of course, but there are people that have stress is debilitating mindsets. And the stress is debilitating mindsets in general, when you look at these two types of populations, tend to have these effects that we were just talking about. They experience the stress in an overwhelming way. They have a very negative attitude. They then have changes in a negative sense in their physiology. I'm going to show you some of this data. So the first one I want to show you is about exercise, physical activity and exercise. And as an exercise physiologist and somebody that's been doing my work on skeletal muscle for 10 years, what I can tell you is that exercise is stress. If I measure somebody that is exercising, everything that you don't want to happen as a physician happens. Blood pressure goes up, heart rate variability goes down, all these metrics, inflammation goes up. And yet we know on the other side of it that exercise is going to be highly beneficial to the body in the long term. And so why is that happening? Well, Dr. Crum did a research study. She was actually a student at Harvard University at the time, and she was working with Ellen Langer, pretty renowned psychologist. And Ellen said to her at one point, you know what, Allie? Exercise is just a placebo effect. And Allie said, what? I don't understand what you're talking about. And so they created this study that was just so beautiful. What they did was they went to 7 hotels in the Cambridge, Boston area in Massachusetts, and they recruited all of the hotel workers. And the hotel workers, as you can see, are moving around all day, every day. They're pushing carts, they're changing sheets, they're cleaning. And for anybody that has ever put a duvet on a comforter before knows that by the time you get it on there, you are sweating like crazy. And so what they did was they took these hotel workers and they put them into 2 different groups. And in one group, they told them, your job is exercise. Your job is physical activity. And in the other group, they told them nothing. They just said, you're a part of a research study. We're going to talk to you about it, but we'll be back in 12 weeks and we'll talk to you about it after that. And so what they did at baseline is they asked everybody before they did the intervention, do you feel like your job is exercise? How often do you exercise? Do you feel like you get enough exercise? And both groups at baseline were exactly the same. And then just simply by being told that their job was physical activity and was exercise, it made all the difference. So on time 1, you can see that both groups, the informed group and the control group, both felt pretty much the same. Whether or not they got enough exercise, and on average, on a scale of 1 to 10, they said they were a 3. Whether or not their job was exercise, again, on a scale of 0 to 0.1, they said it's about a 3. And then in the middle there, do you get a regular exercise? And again, they were a little bit more, excited about it at 0.4, but overall the same. After the study, what they found was that the group that was informed just simply reported different outcomes. So they perceived their amount of exercise was higher. They perceived that they regularly exercised more often, and their perception of their work as exercise also improved. And you could say, oh, that's nice. That's lovely, Rachel. They all thought that they were exercising more. That's terrific. But what's the so what? The so what is if you actually look at their physiologic metrics, and they had accelerometers on all of these hotel workers, and they found that their self-report in food intake did not change. Their accelerometry data did not change. And yet they found changes in weight. They found changes in body mass. They found changes in waist to hip ratio. And this is the one that really gets me. Their systolic blood pressure went down by 10 points on average, just simply by thinking differently about the way that they were perceiving the movement that they got throughout the day. And in a follow-up study that was done just recently, Dr. Crum and her postdoc noted that people who perceived themselves as less active than others, and this is across the population, had a 72% higher mortality risk after 20 years than those who perceived themselves as more active. And they completely controlled for the minutes of activity that each of the people got. So just simply by creating a new mindset around exercise, it did in fact have physiologic changes. And so people often ask me, does any movement count? Well, if, vacuuming the carpet and putting a duvet on, does that count? And the answer is, yeah, the data really shows that pretty much anything that you do counts. I love this study. This was another one that was done at Harvard. And this was a study in middle schoolers. And if anybody wants to remember middle school, or perhaps you have a middle schooler right now, it's kind of a miserable time. I was actually a middle school teacher before I went back to do my doctoral degree, and I taught 7th and 8th grade science. And I can tell you from experience, it is not the most pleasant time of life. Some people thrive, some people not so much. But what they did with this study was they tried to bring yoga into the physical education curriculum for this particular medical school. And it wasn't, challenging yoga. It certainly wasn't, Bikram or Baptiste yoga. It wasn't hot. It was just a lot of, just gentle poses and breathing and teaching people and the students the, breathing exercises that go along with yoga. And what they found was they looked at the groups. They broke them into yoga groups. They broke them into the, whatever PE was at the school at the time. Maybe it was kickball, softball, soccer, basketball, whatever they were playing in gym class. And what they noticed, and here you can see on the left, that the people that got the yoga, the students that got the yoga, got a little bit better in total mood disturbance, in anxiety, in depression, fatigue, positive affect. It got a little bit better. And when they looked at that data at first, the researchers were like, oh man, this is a friend of mine. He was like, shoot, like the yoga didn't work nearly as well as we thought it was going to. And then they looked at the students that didn't get the yoga in the middle school. And what they found was that all of those metrics tanked in the group that didn't get this coping strategy. They didn't get that breathing. They didn't get that gentle activity throughout the day. And I love this when you go and you listen to these researchers present their data. They say, you know what, yoga might not be lighting the middle school world on fire, but it makes middle school suck way less. So when we think about physical activity, I think we need to reframe this in our mind that it doesn't have to be getting to the gym every day. It doesn't have to be that hard, high intensity interval training. It doesn't need to be the, intense strength training or spin classes or the things that we're told that we need to do by the fitness and wellness industry, which I love. I've been a member of the fitness and wellness industry for a long period of time, and I'm working with them on this as well. But what I would like to just point out is that any activity can be beneficial. And in times of stress, in times when there isn't a lot of physical time, there isn't enough minutes in the day, simply moving around throughout the day and acknowledging that it is physical activity, it is movement, and it is enough can make all the difference. So what do you need? And this is sort of where you start to take out your notebook and write some of these things down, is what do you need to be able to get any physical activity into your day? So it doesn't have to be block off 90 minutes to go to a fitness class. It's what can I do to be able to just move around a little bit in my day? Counter that with what you think you should do, and just acknowledge that I have been taught as a human of the world that I probably should be getting the sweat, the breath, the hard work, the soreness. But in fact, what we can see is that putting a duvet on a comforter or getting a little bit of gentle yoga and some deep breathing can actually have pretty profound effects. And so what I'd like for you to do is then reframe this a little bit and say, what kind of physical activity am I already getting? What am I getting throughout the day that I actually haven't been counting? And a little note on this is that, and I'm guilty, we all wear these little devices now that ping us and give us reminders and tell you whether or not you're closing your rings. And one of the things that's really interesting if we think about mindset is that for a short period of time, that can actually be fairly motivating because it helps you to get up and get moving. And oh, shoot, yes, I needed a reminder to get up. But in the long term, what we're finding in the literature is that that can actually end up being fairly self-defeating because you set your metric, oh, I should be doing 450 calories of burning a day. And if you don't get it, it resets your mindset to, I didn't get enough. I wasn't enough today. And that is where we start to see all of these detrimental effects. The last piece of this is what kind of physical activity do you love to do? It might not be that you get to do the thing that you love every day, and that's okay. Some days you're just going to do what you can do and let it count. And then you can set some time aside to do the things that you love to do. And that will make that time so much more beneficial because you're engaged, you're in the moment, you're finding more joy in that piece because it doesn't feel like a chore at this point. It feels like I have set some time aside for myself, and this is what I need to do for my body. And I have the time to do it. So we know how much should you be getting. Everybody knows these guidelines, 150 minutes of moderate or 75 minutes of vigorous, sort of any combination throughout the day. But as I just said, you can get this in small bursts that you might not even be counting right now. So if you get 15 minutes per day throughout the day, you're walking around with patients, you take a walk at lunch, you walk to the post office or, to go get whatever you need to get, take a lap around the hospital for 15 minutes, 5 minutes at a time, 2-3 times a day. And then you get to do that thing that you love on a day off, on your weekend, on an evening that you have time. You're there. You're at 150 minutes. And so I think we need to start thinking about this as how can we create those 150 minutes so they work with what we're already doing, rather than saying we're going to have to blow up our entire system in order to get this 150 minutes in, because any activity is better than no activity. So some tips and tricks. What can you do? Well, what can you do? What can you get into your day? And what can you count in your day? And that mindset of I have moved my body today, as the data shows, has a profound physiologic effect. What do you love to do? What can you set aside time for when you have it so that you are engaged, you're there, you're in that sort of peak of stress, you feel focused? Can you double dip? Walking meetings. Do you have a buddy? That's always a good one. I'm going to meet you in 10 minutes. And it will force you to close your computer and go down and meet this person. What's your time frame? Do you have 5 minutes? Do you have 10 minutes? It counts. And then one thing that I know helps me a lot, especially if you work in a place like I do, where anybody can get access to your calendar and put in meetings if you don't block off time, is to actually block that time off. Give it to yourself, put it on your calendar, go move. And if that's the way that's helpful for you, use that strategy. So, a little exercise prescription Mad Libs for yourself. We all remember Mad Libs. I don't know if kids play Mad Libs anymore, but this is a really good exercise. I am active because, and fill in the blank. Why do you do this? In order to find time in my day, I will fill in the blank. Walk with my patients. Take a down dog in the lounge area. I will choose to whatever that is because it is what I maybe love to do, or it's what I can do today. And that is going to make all the difference. A little bit of grace goes a long way. So let's pivot a little and talk about diet and nutrition. So can you use this new mindset to trick yourself into loving broccoli? Well, we're going to give it a try. We'll come back to Dr. Crum's work. And this was actually, she's kind of been everywhere. It's pretty fascinating. This was actually when she was at Yale and she was working with Kelly Brownell. And so if you know Kelly Brownell, he did a significant amount of work with the Rudd Center at Yale. He's no longer there, but on obesity and strategies that we can use to change the environment to help prevent and also treat obesity. And they did this study, and I just love the name of this study. It is called Mind Over Milkshakes. Mindsets, not just nutrients, determine ghrelin response. So if you haven't quite bought into the mindset changes my physiology yet, I'm hoping that this data might change your mind. See what I did there? All right, so here's what we did in this study. They took 2 milkshakes. And this was a crossover design. So they brought a bunch of people into the lab and they said, we're going to give you these 2 milkshakes over a couple of weeks. And we're trying to set up a formula for our patients in the hospital so that they eat them. And we're trying to make the healthiest thing that we can that doesn't go overboard. And so we're going to give you 2 milkshakes on the opposite end of the spectrum. And we're going to ask you, how do you feel about the really indulgent, wonderful milkshake? How did it make you feel? And we're going to give you one on the other side that's kind of a diet milkshake. And we don't really know if it's going to work for our patients, but we're trying to find the happy medium. And so we're going to give them to you. We're going to monitor your body. We're going to see how you feel about it. Not surprisingly, these 2 milkshakes were exactly the same. So they were spread out by 2 weeks. They gave them one. They said, this is, it's got 600 calories in it. It's going to taste really yummy, really rich. And they showed them the label. And then 2 weeks later, they said, oh, this is the diet one. It's probably not as good. It's got only 100 calories in it. And so these are the labels that they showed them on the left here. The one that was left indulgent had the ice cream overflowing. It had the, sauce on it. It had the word indulgent. Showed on the nutrition facts label that it had 600 calories, a ton of sugar. And then they showed them the Sensi shake, which was the one that was supposed to be low calorie, guilt-free satisfaction. It's French vanilla. So now it's got a little flour instead of a delicious ice creamy looking milkshake. And what they found was really fascinating. So when they looked at the people after they had the indulgent milkshake, they said, oh, I feel so full. I definitely indulged. It was delicious. Really enjoyed it. Thank you so much. And at the same time, they were monitoring ghrelin. And so ghrelin, if you know about the ghrelin hormone, it is released in response to hunger cues. So the way that I always like to remember it, and I tell my students, is ghrelin makes your stomach growl. And so if you have more ghrelin, your stomach starts to growl more. And if you don't have a lot of ghrelin, then your stomach does not growl. And so what they found was that after about 60 minutes, the indulgent shake people had a burst in ghrelin. They weren't necessarily feeling hungry yet, but that the Sensi shake had a slight increase in ghrelin. And here is the most important part. 90 minutes later, the indulgent people had almost no ghrelin, or, back to resting values of ghrelin. They were full and they were reporting that they were full. The Sensi shake people 90 minutes later still had elevated ghrelin and they were like, oh man, that shake was just not enough. I'm starving, so hungry. And so not only were they feeling like they had been robbed of a wonderful indulgent shake and had that mindset around it, but their body was responding to that mentality, despite the fact that these 2 milkshakes were completely identical and had about 300 calories each. So they kind of split the difference between what they told them that they were having. And so you can see here that if you operate in a mindset of restriction rather than in a mindset of abundance, especially with food, you're going to end up with that response 90 or so minutes later. And we see this when we put people on diets. So if you've ever worked with a patient and said, you need to, cut your food down, or you've experienced this yourself, they're constantly starving. And it's partly due to changes in their hormones. And this data has been pretty well represented, is that when you reduce calories, those hunger hormones go up. But even in this case, what we can see is that regardless of the actual food that you get, if you feel as though you are in a situation of restriction, your body responds to that. So we need to think about how we, and maybe even using this strategy with your patients, can eat in a mindset of indulgent. So Dr. David Katz, you probably know him. He is, we've worked with him a lot with the American College of Lifestyle Medicine, says, our culture doesn't want to hear that the active ingredient in broccoli is broccoli and that it's magical and wonderful. What we want to know is, what supplement can we take instead of broccoli? So what can we do in order to create a new mindset around food so that we feel like broccoli is just indulgent? I'm not going to tell you what to eat, because we all know what a healthy strategy is. And you can end up on any side of the healthy spectrum. The healthy eating spectrum is what I call it. You can be a vegan and be certainly very healthy and feel really wonderful about your food. You can go all the way out. There's even some emerging data that ketogenic diets might not be that bad for you. We can have a discussion about it after the talk, but you can be on either end of the spectrum. What's similar in all of these diets that end up having positive health outcomes are fruits, veggies, fish, nuts and seeds, spices, perhaps some chocolate, because we must have indulgence, and then some kind of hydration. So let's think about how we can reframe some of these things so that they end up on your plate in a mindset of indulgence. So fruit, I'm going to blow your mind here and say the reframe is, sugar from fruit is really good for your brain. You know that glucose is the fuel that your brain uses exclusively, unless you're in ketosis. And so you need to have that drip of sugar throughout the day so that by 2-3 o'clock in the afternoon, you're not falling asleep at your desk and you're not foggy and making mistakes. And so when we think about fruit, we think about it as a slow drip of sugar. You get the fiber, you get those micronutrients, you get the phytonutrients, and all of these are going to come packaged together with just enough fuel that your body is going to top off its stores without getting that rush of sugar and the resultant insulin response. So sugar from fruit is good for my brain. If you are feeling low in the afternoon, go grab some berries, go grab a banana. And that, as you know, because you know this physiology, is going to result in you feeling better 45 minutes later, rather than you having that low blood sugar insulin crash because you have overdone it with other kinds of sugar. Veggies. The reframe for veggies is, fiber from veggies is good for my gut. Every time I eat a vegetable, the little bacteria in my gut are so happy. And if there's anything that we know from the fitness wellness world right now, even though they're well ahead of the data, is that a healthy gut is a happy gut. And we all want to have a healthy gut microbiome, and we want to be make sure that we're avoiding any of the dysbiosis. I would have to say that data is not quite there for all the products that are on the market yet. However, what we do know is that we can rely on fiberful fruits and veggies, and those with the fiber tend to be the food essentially for those bacteria that are in your gut that are actually going to make it thrive. So sugar from fruit, good for my brain. Fiber from veggies, good for my gut. Fish, fat from fish is good for my heart and brain. So this is going to be the primary source for our omega-3s, which are anti-inflammatory, which we know are so important for cognition, and the data is getting stronger and stronger there. So how can you reframe, man, I really would love to have a steak tonight, to, you know what? I need to be on point tomorrow. Tomorrow is going to be hard. It's going to be stressful. Can I prepare this other type of meal so that I am set up and ready to go? Nuts and seeds. The fiber, again, really important from nuts and seeds, although you do also get these wonderful unsaturated fatty acids from nuts and seeds. These are going to make me feel full. So if you get to that 2 or 3, o'clock time at the end of the day, and you're just like, man, I am starving, keep some cashews or peanuts or nuts, almonds, anything that feels, that makes you happy. keep it in your desk drawer and reach for those. Interestingly enough, because of the food matrix of nuts particularly, you actually only end up absorbing about 60% of those calories anyways. So it's not like you're being indulgent, even though it's kind of a fatty food. The fat's really good for you. The fiber is going to make you feel full. And at the end of the day, it kind of ends up being a lower calorie snack than some of these fiber one bars or whatever it is that that we all keep in our bags. Spices. If there's some area of research that's just exploding right now in nutrition, it is how potent phytochemicals are. The interesting thing is that we're finding is that the phytochemicals all work synergistically. And so when we add things like oregano, celery seed, rosemary, sage to our cooking, all of those phytonutrients are going to work in synergy to help our body as mostly powerful antioxidants. Interestingly enough, and this goes to Dr. Kat's quote, is that if we extract them and make them sort of supraphysiologic doses like we do in supplements, they don't tend to work as well. And so the spices, the fruits, the vegetables, this is where the magic truly is. Chocolate, do I need to reframe this? I think not. Quite good for you. It is number 4 out of 100, the more dark chocolate that you get in polyphenol content, which are also those wonderful phytonutrients that we've been talking about. So have some dark chocolate around. Maybe your snack in the afternoon ends up being a little square of dark chocolate and a handful of almonds. Drinks, hydration is critical. So we know that you get about a 20% reduction in performance with a 2% reduction in dehydration or in hydration, so resulting in dehydration. And so you can have dramatic effects. If you're feeling fuzzy, if you get that brain fog feeling at the end of the day, it is probably likely you are dehydrated. And one of the reasons that you might be dehydrated is that as healthcare providers, you talk a lot all day. And so you release a lot of moisture as you are talking. Even if you are drinking water throughout the day, it's really hard to stay ahead of that. So water is going to be your go-to. Coffee and tea are really wonderful for you. The red wine is kind of a question mark. We've got data, it's like the new egg data is that red wine's good for you, red wine's bad for you. We of course know that alcohol is carcinogenic, so be gentle on the red wine. Don't use it to de-stress, use it in a moment of joy. And then I'm going to show you some really interesting data on tart cherry juice when we talk about sleep next. So let's pivot into our last topic here, which is sleep and recovery. I think one of the things that we hear often in our profession, which are get up early, stay up late, and work all day kind of professions are, I'll sleep when I'm dead. I've got patients to talk to. I've got charts to review. I've got research to write. I've got grants that have deadlines. And so this idea of I'll sleep when I'm dead is kind of prolific in all of our circles. And I'm hopeful that you know that that is a terrible idea. I also recognize as somebody that is part of your tribe that it is really hard to not go by this mantra because there's just so much work to do. But I'm hoping I can convince you a little bit otherwise. So I'm going to tie it back to our last topic, which is nutrition and sleep. And we're going to talk for the last couple of slides about what to eat to get to sleep, what to eat to stay asleep, and then what you can eat to help wake up. So these are sort of more holistic strategies to creating a healthy sleep hygiene behavior. So one thing that's really important to note is that sleep and circadian rhythms have been kind of all over the place with COVID because we're at home. We have, work never ends when we're working from home. We've got calls that are coming in all the time. And healthcare workers specifically are suffering from really serious sleep disruptors and changes in sleep patterns during the last 2 years. So insomnia result in anxiety, perhaps depressive symptoms that are related to sleep deprivation. And what we see is that because we are missing a lot of our norms, so things like social support, sense of belongings, there's a lot of churning that happens in the evening in our brain. And when we have those things around, what we see is that there's less psychological symptoms and you get better sleep quality. But since those have been taken away, sleep quality has been affected. And as a result, this confinement, atypical work schedules, change in our sort of, homeostasis, and we end up with this really weird dysregulation of sleep and wake cycles. And so I'm going to give you the sort of quick and dirty of things that you can do to manage your sleep, which you probably already know. And then I'm going to show you some strategies that could potentially really help. So number one is prioritize sleep. I know, better said than done, but something to consider. 6 to 8 hours. Regular schedules really help. So even if you're on a weird schedule, just staying on that weird schedule, if you're a night shift worker, can be really helpful. More exposure to sunlight. So we know that sunlight is going to be critically important for modulating adenosine, and that is going to help you to wake up. Getting up at the same time every day can be really helpful even on the weekends. And reserving the bedroom for things that should happen in the bedroom. So try not to have a TV and try not to eat in your bedroom because those are going to stimulate behaviors. And then looking at short bouts of insomnia, these are pretty normal for stressful events. But what we want to do is try to create those coping strategies so that they don't become chronic. So as you can see, our bodies happen to work with sleep and wake schedules on circadian rhythms that happen around light and dark. And I'm not going to go into great detail on the left, but what you can see is that when you are exposed to light and dark, it's going to have significant effect on the hormones that are going to regulate metabolism and other behaviors and physiologic processes in our body. And when our circadian alignment is misaligned, we are not waking and sleeping with the light and sun. We actually end up with weird lifestyle behaviors. So we have, if we have lights at night, like our screens, we are not able to go to sleep as quickly. We feel that we need to sleep during the daytime. That's a very physiologic drive. And we also end up having a higher appetite in the evening. So what can we do? First thing is to naturally encourage melatonin. So you know this pathway, tryptophan becomes serotonin, becomes melatonin. One thing that are good are carbs in the evening time, which encourage tryptophan concentrations to be converted to melatonin. So being careful of those high fat, high protein diets, especially in the evening. Warm milk could actually be a strategy. Grandma was right. The number one reason is it's soothing. It just feels nice maybe to drink some warm milk. Be careful if you add chocolate, it's got caffeine in it. But it also has high levels of alpha-lactalbumin. And alpha-lactalbumin contains a significant amount of tryptophan. And also milk has a little bit of melatonin. Lastly is tart cherry juice. So tart cherries are sort of an interesting supplement that we're looking at across the performance space. They contain melatonin, and also they have really interesting antioxidants that work at just the right physiologic level that might help reduce inflammation overnight that could wake you up. Be really careful about eating before you go to bed. You want to have your last eating event 2 hours at least before you go to bed so that you're already deep into that digestion process so that it doesn't wake you up. As I mentioned, we want to lean more toward the carbs in the evening. They're a little bit quicker to digest. And if you have a big meal and you go to bed, that increased metabolism, increased body temperature because of metabolism, and increased heart rate is going to wake you up. So 2 hours before you go to bed, stop eating. Be careful, although we talked about how wine might be lovely, be careful about the wine, mostly because of the alcohol. So alcohol, as you know, is a depressant. It is going to help you fall asleep. That is true. The problem is as you metabolize that alcohol, it's going to help your body to wake back up because that depressant starts to wear off and your body starts to feel like it needs to wake up. So again, with this, don't eat 2 hours before bed. The rule also holds for wine or any alcohol that you're drinking in the evening. Are there any natural remedies that you can take? Well, maybe tea could be good, chamomile, for the same reason that warm milk. It's just soothing, it's relaxing. You can take melatonin in pill form, so 3 to 5 milligrams, not more. You don't need more than that. We live in a society where a little bit is good, a lot is better. You don't want to be doing that to your body with melatonin or any supplement for that matter. We want just that right sweet spot. Interestingly, you can also try to supplement with magnesium pills. So this is actually going to help specifically work with the autonomic nervous system to bring on the parasympathetic, take your foot off the accelerator of the sympathetic nervous system. One thing you want to be careful about with magnesium is that it can cause GI distress. It's used as, to help with constipation. It can cause diarrhea. And if you want more food sources, you can come back to dark chocolate. Enough said. Avocados, nuts, seeds, green leafy vegetables also have an abundance of magnesium. So you could try to put those into your evening meal. Lastly, waking up. When we think about waking up, the first thing that you want to have in the morning is water. You want to put lemon in it, totally fine. It's not going to rock your world. It's not going to do anything crazy. It might just help you, enjoy the water a little bit more. Caffeine is going to work in the morning. It's going to bind to those adenosine receptors, which drive sleep. It's going to turn them off. And the same thing happens when you look at sunshine. So what I like to tell people is when you wake up in the morning, have a glass of water while your pot of coffee is making, take a little, hydration break, and then go enjoy your coffee by a window, or if you're in a place that you can go sit outside, go do that. Take those deep breaths, take in the caffeine, take in the sunshine, and start your day off right. So take home messages to finish it off. Your mindset actually makes a difference. And I'm not talking about it's going to make you feel better if you have a bright outlook on life. I'm talking about it can physiologically change the mechanisms that we know to work in your body. All movement counts. Count it. Let it change your mindset around physical activity. Eat the foods that we know are beneficial with a reframe, with a mindset of indulgence. Sleep, and sleep now. Please don't wait until you are dead. We know that sleep is critical to enhancing all of these other mechanisms. Please set up a strategy, a sleep hygiene strategy that's going to help you at least prioritize sleep, even if it doesn't quite get you through that whole 8 hours. And then lastly, I've said it a couple of times, but have a little grace for yourself right now. Count what you can, do what you can, do the best you can, but these are challenging times. And if you can't do everything, that's okay. So I will stop it there. If you want to contact me, this is my contact information. I'll take any questions that you have. I know we're sort of right on time here at 6 o'clock, but I'm more than happy to stick around for a few minutes to answer any questions. Thank you so much for inviting me.
Thank you so much, Rachele. That was excellent. Does anybody have any comments or questions? If you raise your hand and then or put it in the chat, we can address them. We have a few minutes, but I realize we are going over time. Or you can just unmute your microphone and ask. Feel free to do that too.
I've given everybody all the tips and tricks they need.
Exactly. We're all trying to write it down. So I'm just looking at the chat. It was fantastic. Thank you. Great
pleasure.
advice. And Leslie, did you have anything?
I was thinking about minds. Thank you so much, Rachele. That was a terrific talk. I was thinking about mindset and the word resilience. Often when I do a teaching session on wellness or try to open that talk up, there's almost a negative mindset about the word resilience. I wonder how you manage that.
Yeah, I mean, I think that this is, this idea that we need to disentangle the, I call it this Pollyanna attitude from, this idea of we have stress in our lives, and resilience doesn't mean that you're going to be able to just power through it and it's going to be fine. And it also doesn't mean that you're going to never experience stress because you are a resilient person. So I like to use these, words like coping strategies or, behaviors that are going to help you through to the other side. And I found, when we look at, I sort of mentioned this in the beginning, but I train war fighters, I train tactical athletes that their jobs are quite stressful. They know they're going to go into it and they're going to experience stress. And they really appreciate and understand this, I feel like, better than everybody, because they know that if they don't have those coping strategies, they're not going to be able to do their job and do their job well. And so I think about it a lot. And Dr. Crum did a significant amount of work with Navy SEALs that, this idea of resilience isn't about creating a hard candy shell. It's about creating and cultivating tools that are going to help you deal with the stresses that are inevitably going to be there.
Very helpful. Thank you.
Any other questions or comments? Feel free to just unmute your mic and ask.
Thank you, Rachel. That was great presentation. I wonder what would be your comments in terms of like the role of, I need to get my video on, role of nutrition also in terms of the energy level. Like people, if eat better, like that would impact also their, they feel less tired and.
Yeah, 100%. So one of the things I did a significant amount of work when I was in Boston at Harvard at the Joslin Diabetes Center. And so one of the things that's critically important is maintaining blood sugar at, sort of a level, up and down as you eat throughout the day. And one of the things that we see, especially with the foods, and, I totally understand and I totally get that we're all eating on the run and we're eating on the go and we've got bars in our bags and everything. But what we see with much of these foods that we're carrying around is that we have these pretty massive sugar spikes, and then insulin works, right? It's a really potent hormone and it's going to follow that sugar and it's going to try and get it out of your system as fast as it can. And when it does that, that's when you feel that slump because your blood sugar has essentially now gone low. And it's subtle. It doesn't have to be that, you're hypoglycemic in order to feel this. Your brain is going to recognize when there's, a lull or a dip in blood sugar, and it's going to want to lay you down. It wants to put you to sleep if it does not get enough energy. And so the idea here is that if you can eat things that are going to maintain that slow drip of glucose, we want to have glucose. Your brain needs it, but just not from a fire hose, 4 times a day, because you're going to end up with that roller coaster. If you can think about, rather than reaching for the thing that's in the vending machine that is highly processed carbohydrates, or, the bars that are going to have added sugars in them, cereals, these things that are going to be pretty refined grains, and really start to think about how we can shift to the more fibrous, natural sources of these foods. That's going to maintain that blood sugar throughout the day, add some protein in, add some healthy fats in. And now we're really cooking here with maintaining that blood sugar and giving yourself and your body the nutrients that it needs to not feel like it's on a roller coaster all day. And that's without even talking about all of those phytonutrients that are super wonderful that are in plants and in fruits and vegetables and nuts and seeds that we're only just able to start to classify and understand what they're doing. But we do know that they're certainly beneficial for health and potentially even for thriving.
And I just also, want to add, I'm not sure that you touch on beans, or maybe I missed in the picture or your talk. Did you? Like, what's your thought on that?
Yeah, I would certainly put beans into that high fiber, they're a little starchy, but high fiber category. It's going to create that slow drip. They also make you feel really full. And one of the reasons that they make you feel full is that your gut bacteria love beans. They really, really like lentils and black beans. And this is why you get a little gassy after you eat the beans, is because when the bacteria start to munch on that fiber, quick biochemistry lesson, you don't have an enzyme to break down fiber in your body, not a single one. The only thing that does is the bacteria that lives in your gut. When they start to break down that fiber or ferment that fiber, they release gases, they release short chain fatty acids. And as a result, you might feel a little bit gassy. That being said, the more fiber you eat, the less you experience that. So keep eating those beans. Small doses at first, and then start to make them bigger.
Excellent. Rachele, there's one question. Do you have any advice for physicians who are on call 1 and 3, who are routinely awake in the middle of the night, early morning? The idea of going to bed and waking up at the same time every day is
really challenging.
Just not possible.
Yeah, 100%. So this is something that we are working on, and there's a couple of groups at Tufts that are really working on this right now, and sort of all over the place, but they're specifically starting to look at circadian rhythms and shift workers, across the board. So healthcare workers, factory workers, just anybody that's up at weird hours or overnight. And I think that the strategy is to sleep. The first strategy should be to get as much sleep within that 6 to 8 hour window as you can, even if it's not consistent. We're getting exactly the same amount of sleep at exactly the same time every day. So that's strategy number one, is just how can you get a good solid chunk of sleeping into your schedule? So trying really hard for 6, 8 hours. I recognize that that's really challenging. However, that's sort of the goal number one. And then to create eating strategies that are around that chunk of sleeping time that mimic what would be a normal sort of 9 to 5 type of schedule. So again, not 2 hours before you go to sleep, because the same thing will happen. So if you eat 2 hours before you go to sleep, even if it's at, whatever time you get off your shift, then you're still going to experience that increase in metabolism, that increase in temperature, that increase in the mechanisms that are going to keep you awake because digestion is happening. So again, that 2 hours before. So if you know your shift is ending at a certain point and you're hungry, scheduling those eating times so at least it's 2 hours or more away. The other thing is being really careful about grazing in those shifts, because that tends to really happen with these overnight shifts, with odd shifts, because you're not on a strict eating schedule. And so that's where we see there's, unfortunately, to who asked the question, there's some not particularly promising data for shift workers on hypertension, on overweight, on obesity, on inflammatory mechanisms. But one of the hypotheses is because there's just no schedule at all. And so if you can think about how you can pack lunches or food, you can have meals that you're not just sort of picking at things constantly throughout your entire shift. That could be a really important strategy. So 3 really important things. Number one, figure out if you can get that good solid chunk of sleeping time around your shifts. Number 2, be careful about eating too close to that time so that you can actually sleep. And number 3, be very careful about grazing as you move through your shift. Thank you. They're not perfect strategies, but they're what we have right now.
Exactly. Well, I think we're coming up past 10 after, so we should probably sign off. We really want to thank you. And I love the idea of just being kind to yourself, and we're all a bit of perfectionists, and we shouldn't beat ourselves up if we don't get our hour of rigorous activity every day.
Yes,
and if we ruin our vegan diet. Okay. Well, thank you very much. And thank you everyone for joining.
My absolute pleasure. Thank you so much for having me. I really appreciate being able to speak to your physicians.
Thank you. This recording will be posted on our website. And we'll stay tuned, and we'll let you know when our next speaker is. Thank you, everybody.
Thank you so much.